Hello students, welcome to our channel Pharmacology Adda. Today we are going to discuss about the basal cell carcinoma, and in the previous lecture I have already discussed with you about the basal cell carcinoma, its introduction part, that it is the most common cancer, slow glowing, rarely metastasizing tumor, and the etiology like the UV rays, X-rays, radiation and mutation in the tumor suppressor gene TP53, etc. I have already discussed with you its clinical feature, that it appears on the middle third of the face, and the it has a late latency period, that is 30 to 40 or 50 years. I have already discussed with you about that. The white fair complexion people who has less melanin in their body is more prone to the carcinoma of basal layer, that is basal cell carcinoma. And about that this tumor, that is basal cell carcinoma, is having 6 subtypes like nodular, micronodular, pigmented, superficial, morphiform, infiltrative, etc., and cystic form, etc. So now we are going to discuss about the histopathology of the basal cell carcinoma. The basal cell carcinoma histopathology tells us that any tumor, it can any carcinoma needs to be most confidently identified by the help of biopsy. Biopsy can be done by this tissue, with the help of surgery, taking a tissue, and then biopsy, we confirm about the type of carcinoma. The first, that is types of carcinoma, is the basal cell carcinoma, that is nodulostatic carcinoma. Okay, sorry, nodular carcinoma. In the nodular carcinoma, we are seeing that when we do the biopsy, in the diagram elsewhere you will be seeing that there is a hyperchromatic ovoid nuclei, means there is a high chromatism. Yes, this is true. In any malignant tumor we see hyperchromatic nuclei. So there is a large hyperchromatic nuclei, ovoid nuclei is seen. The cytoplasm will be little or will be in the less amount, but the nucleus will be arranged. This is the histopathological feature. So we will see the position of nucleus. So the nucleus will be arranged in a nest like form. जैसे कि चिड़िया एक घोंसला बनाती है तो कैसे चारों तरफ से अपना घोंसले को बनाती है, उसी टाइप से नेस्ट जो चिड़िया बनाती है, तो सेम वैसा ही यहाँ भी न्यूक्लियस देखने को मिलता है. ओके, that is, the nucleus will be arranged in a nest like form and the cell will be uniform. The mitotic figure, that is the rate of mitosis, will be few in number, and the cell at the periphery of the nest, that is those nucleus which are arranged, will be covered or surrounded by the cell. So the cell that will be at the periphery will show palisading. In the odontogenic tumor, you have heard about the palisading of the cell. That will be the fencing type pattern. Like you must be have heard about the fencing type pattern. This type of pattern. Okay, this type of pattern is seen. Okay, the and there will be increased amount of the mucin. I am here. Okay, so the cleft formation. This one important feature, that cleft formation, I have already discussed in the previous lecture how the cleft is formed, but here the cleft formation, which is also known as retraction artifact, is commonly occur between the nest and the stroma, because of the shrinkage of mucin. You must be understanding what I am telling you, that there is a cleft formation occurred, which is also known as retraction artifact, and this is commonly seen occurring between the nest and the stroma, and shrinkage of mucin during the tissue fixation and the staining process. Okay, that is cleft formation is seen there. I have seen that there is a lobules. Okay, in the histopathology, you will see there is a lobule that show the area of pseudogranular change. This is very important. That is the area of pseudogranular change, and this is the characteristic feature of adenomatoid BCC. Okay, let's come to the next part, that is nodulocystic. Means nodule भी है और cyst भी formation हो रहा है. मतलब this tumor has larger size and the central degeneration. will be seen in this tumor. This is the minimum biopsy, and all the feature of nodular basal cell carcinoma will be seen. Now the pigmented, in which we have discussed earlier that there will be a brown or red pigmented. So in this big pigmented basal cell carcinoma, in the pigmented basal cell carcinoma, there will be the large tumor size. Okay, benign melanocytes means melanocytes are melanin producing cells. So there will be the benign melanocyte in around a tumor and produce large melanin. Okay, so the amount of melanin will be large, and the melanocyte contain melanin granules. Hence, this is okay. Okay, superficial basal cell carcinoma. The superficial basal cell carcinoma will appear like a bird. Okay, you have heard, you have seen that bird of some tumor that is like this type. Okay, this type. Okay, this is called the superficial basal cell carcinoma and appears as a bird. Okay, and attached to the underlying superficial epidermis. So this is seen in the case of superficial basal type of carcinoma. The nest of the various size. Okay, जो cells होते हैं वो different size के arranged होते हैं. Means this will be the nest. Okay, think that this is the nest. So in some there will be a small nest, in some there will be a large nest. This is seen in the basal superficial basal cell carcinoma. Now the morphiform. The morphiform basal cell carcinoma, the strands of cell will be seen here. No nest-like form is seen. No nest-like cell means round जो nest cells होते हैं absent होते हैं ये. Okay, they are absent, but the strands of cell will be seen. Okay, now infiltrating basal cell carcinoma, there will be a spiky irregular stain. This is all about the histopathological feature of the basal cell carcinoma. Means these strands of cell in the morphiform will be seen to be embedded in the fibrous stroma. So this was all about the nodular basal cell carcinoma. Now I am going to discuss with you about the differential diagnosis. Means a patient comes to you and you have diagnosed the features and you have seen the feature and you come to a conclusion that yes, this can be the tumor, and this type of the tumor it is. So the first differential diagnosis you will be seeing is the actinic keratosis. Yes, there will be cirrhosis is seen. So actinic keratosis, you can tell women's disease. Keratoacanthoma I will discuss with you in the next video. Melanocyte nevi, sebaceous hyperplasia, and seborrheic keratosis, squamous cell carcinoma. This all can be seen. Okay, differential diagnosis. Now the treatment part. This tumor is since not metastasizing, it's rarely metastasizing. The borders are well defined, so enucleation can be done, that is surgical excision, and radiotherapy and chemotherapy are the prime goal of the treatment of cancer. So we can go for this. If the lesion is small, we can go for less than 1 centimeter, that is lesion, then we go for surgical excision of the cancer tumor cells. And since the 50% laser enucleation and cure rate is 95 to 98%, and 50% recurrence rate is seen in the case of this type of tumor. Okay, now the surgical excision of tumor with the help of X-ray radiation. Okay, then 50% chance of failure or reoccurrence. The tumor has good prognosis if the tumor size is larger, or if there is local invasion, then there can be even death. Somewhere in the diagram you must be seeing that the on the local invasion how badly it affect. Okay, and in the initial picture you have already seen. If you have not watched my first video, please go and watch my first video first. Okay, description will be given in the link. In the link will be given in the description box. So the tumors reoccur and invade. Then if there will be reoccurrence, then we will use the Mons micro micrographic surgery, one of the most important micrographic surgery in which we go again and then select the tumor cell and then cut the whole area. Okay, that is surgical excision. Some important thing that you should write in your notes, that necrosis of epithelial island may be seen, a cystic appearance will be seen, actinic damage in the form of solar elastosis always seen in the stroma in the case of basal cell carcinoma. And one more important thing, that if you write you can, that basal cell carcinoma when mixed with, okay, when mixed with the squamous cell carcinoma, it is called as basosquamous carcinoma, and it is nowadays called as abundant squamous metaplasia. So this was all about the basal cell carcinoma, guys. If you have any doubt, any queries, please do let me know in the comment section box. And also you can join me on my WhatsApp group, Pharmacology Adda. Link will be in the description. And if you like my video, please like, share and subscribe with your friends too. Please subscribe my channel. Thank you. And guys, one more thing, the notes will be given in your WhatsApp group and also on the Instagram page, that is Pharmacology Adda. Thank you, that's all. Stay safe and stay healthy. Jai Hind, Jai Bharat.